In the United States, approximately 38 million adults, equivalent to 1 in 10 Americans, are diagnosed with type 1 or type 2 diabetes. This research focuses on identifying and addressing gender specific disparities and biases, aiming to better understand the unique challenges faced by each group and managing their condition. Gender gaps in the healthcare system continue to become a barrier for those dealing with chronic conditions such as diabetes. Exploring these gender differences, we seek to inform more equitable and effective interventions for improving diabetes care outcome.
The purpose of our study was to explore the perceived barriers to care that gender may have on diabetes management. We were able to reach 23 participants, 14 female and 9 male, that met our inclusion criteria of having type 1 or type 2 diabetes. Our survey asked about demographics such as age, gender, gender identity, level of education, income, and ethnicity. We had an option for gender identity as we felt that previous studies did not speak to gender inclusivity. We also utilized the Diabetes Distress Core Scale, along with the motivations and attitudes towards changing health or match assessment. The Diabetes Distress Core Scale gave us a numeric value between 1 and 5 that measured the participants' distress levels. The match assessment gave us more insight into the motivations and attitudes towards changing healthcare outcomes. The last portion of our survey asked open-ended questions about whether or not the participants felt that their gender or ethnicity were barriers towards their diabetes management. We were able to take this data and compare the responses between the male and female participants.
For the Diabetes Distress Core Scale, we found that males had an average score of 2.069 and females had an average score of 3.180, which showed that women overall had more distress about diabetes care. For the match scale, male participants had an average of 3.913 and female participants had an average of 3.635. This showed that males overall scored higher than females for motivation to change. These findings then correlated with our qualitative findings, which showed that 3 of the 14 females felt that their gender was a barrier to their care, in comparison to the 1 out of 9 males who were unsure if their gender affected their care. Some recommendations include more gender-inclusive therapies to help aid individuals who are dealing with type 1 and type 2 diabetes. This can include therapeutic interventions that target gender norms or simply training on gender inclusivity in diabetes clinics. One recommendation for further research would be to maximize the sample size by reaching out to more diabetes-based organizations.
We want to thank the individuals who participated in our studies, as well as our friends and family who supported us throughout this journey. We also want to thank the UOP MSW program, our faculty advisor, Professor Porras, and the Abbott Scholarship Foundation for their continued guidance throughout this research study.
Thank you very much.